This is Alyssa with Midwest Healthcare Career Training Development, the Certified Nurse Aide Training Program. We're going over procedure number 37. Procedure number 37 is oral care for an unconscious resident. So we have all our supplies. Of course, I have a pair of gloves. We have the oral mouth swabs. We have an emesis basin. We have 2 cups here. We have a cup with just water, and we have a cup with 50-50. Remember, 50-50 will be, we're going to use 10 cc's of mouthwash and 10 cc's of water. So this cup right here is 50-50 of mouthwash. This cup is just water. And again, we have the oral swabs. We have the patient position in lateral position. We have our pillow. On the pillow, we have a towel. And so what we'll begin with is that we have to do our initial step. So we did the initial step. We did get a report from the nurse. We know that the patient, because the patient cannot speak or talk or respond, we know that the patient is on aspiration precaution. So that's why, and the patient has swallowing difficulty. So that's why we have to provide oral care with the patient in lateral position. And again, we do have the towel that's draped on the pillow, and it's under the patient's chin. We have to position the patient on the unaffected side. So the patient is positioned on his unaffected side. We have our gloves. And I already have my gloves on, and I have my emesis basin. This is the emesis basin. I'll position the emesis basin under the patient's chin. So I have the emesis basin in position. And so what I'm going to begin with the mouth swab. I have my 50-50 solution. I'm going to just damp it into my solution, and then I can go ahead and clean the patient's mouth. So while I'm providing the oral care, what I'm looking for is I want to make sure that the patient's teeth, mouth, tongue, and lips does not have any odor. I don't see any cracks or sores or bleeding gums or discoloration inside the resident's mouth. So, but with the swab, what I'll do is I'm just going to start at the top of the mouth. Just make sure I swab the teeth, the tongue, the complete oral cavity. And so then I'll dispose of the dirty swab. And I might have to use 3 or 4 swabs just to make sure that I provide the patient with great oral care. But remember, the swab, I'll begin with the top teeth, the oral mouth, and the bottom teeth. And then again, I'm doing an assessment. What I'm looking for is I'm checking the teeth, the mouth, the tongue, and the lips. I want to make sure that there's no odor, no cracking, no sores, no bleeding, gums, or discoloration. If I didn't notice any discoloration, I would make sure that I report that information to my nurse. And so I checked the patient's oral cavity, and everything was great. Again, I didn't notice any odor or cracking or sores or bleeding or discoloration. So what I'll do is I'll just chart that the patient was provided with oral care. And so that completes the oral care. And so the last step is that I do have some lip moisturizer. And what I'll do is I'll make sure that I apply it on the resident's lips, because the Indiana State Health Department said one thing that we have to do with patients that are unconscious, we have to make sure that we give oral care at least every 2 hours. So that completes procedure number 37. At this point, I would remove my gloves and wash my hands, and I would make sure that I do my final step. Thank you.